There is water everywhere, deep and unfathomable water everywhere. In the middle, the small villages of Lakhai sub-district of Hobiganj floats for almost 6 months a year. Housewife Josna Begum is a dweller of a similar kind of floating village named Mirpur. 2 of her children died after she got married in a tender age and moved in her husband's house. Josna's faced the biggest problem during the birth of her 4th child. While trying to deliver the child in her house, the child's hand came out first. Josna decided to go to the town.
The baby's position was upside down. Hand of the baby came first. The midwife told me, and I thought if the midwife tries normally, as she doesn't understand things that properly, I thought it would be better not to try in the home. I wanted to go to the hospital and have a cesarean.
Josna's mom and sister's life were at risk during the child delivery as well.
When my mother was giving birth to baby, it was stormy outside. It was impossible to take her to hospital. The midwife took the baby's head out and the body remained inside the womb. In that critical condition, she was rushed to Hobiganj. There the doctor removed the rest of the body. My sister had the same problem during child delivery. The child died. Her urinary tract was teared.
Housewives of the Mirpur village said that pregnancy is synonymous to death here for the reason of travelling to Lakhai Main or to Hobiganj.
The whole area has no doctor except Hobiganj. Bringing the doctor down here from Hobiganj or taking the mother there, sometimes mother or sometimes baby dies. The village has no midwife and 4 to 5 women are going to have babies. If there's some who can take risk, then the mother can be taken crossing the river. Otherwise, the mother dies in the bank of the water. In rainy season, boat runs. If it's dry, walking is tiring. At midnight, a pregnant woman cannot be taken to the hospital. They have to bear the pain till morning.
Just beside Mirpur, there's another floating village, Modna. Recently, a community clinic is being operated here. The only health assistant of the clinic, Sheila Rani, says that even though she is willing, but there is no opportunity to give medical care to the pregnant.
The expecting mothers come to me as I am women and can take service from me. But I cannot provide any service. I only give iron tablets from the clinic and the advices I know and the dose for tetanus.
Profession of the people of the Madna village is fishing. Shimul Rani of this village helps the pregnant women to deliver without any training. 5 months pregnant Durga Rani is also depending upon her to deliver her baby.
If the child does not move, then it's a problem. I cannot count how many deliveries I have done. People call me when there is no doctor.
The furthest village in Lakhai's marshland is Shibpur. The community clinic that was built some 10 years ago is nothing short of abandoned building. The villagers cannot go there and health workers cannot go there as well. Young Farooq of the village told us that his mother died while giving birth. Delivering 2 stillborn child, his wife is also fighting for life.
My mother died during child delivery. My own mother. I got married 1 year ago. Our 2 children died. When my wife should have given the anti-tetanus, she was not given because the place was far away and a pregnant woman cannot walk to that place. The roads are very bad. Even taking her in Hobiganj hospital, the baby had tetanus. I spent 15 to 20,000 taka but couldn't save the babies. Many women even die of the labor pain. Many people carrying the mother carries her or manages a boat. Some takes via launch. By launch it takes 6 hours to 40 km away Bhairab. Many women die in launch. During these 6 hours, some die while going there, some are saved. These are the main problems.
6 ঘন্টার ভিতরে অনেকে লঞ্চের ভিতরে মারা যায়, আবার অনেকে রাস্তাত মারা যায়, কেউ ভালো, এই সমস্যা।
শুকনো মৌসুমে এখান থেকে হাঁটা ছাড়া একমাত্র কোনো উপায় নাই।
In the dry season, walking is the only way out. In the rainy season, the boat. The new health complex has no work. It's closed. Its operations are done in a house in the village is Tuesday and Saturday. They only give tablets and nothing else.
আমরা চাই আমরা গ্রামের মা বোন যারা আছে এরা যাতে সেবা পাক।
What we want is our women to get proper services. If the road is connected to Lakhai, we can get treatment in Dhaka or in Hobiganj or in Sylhet. Had it been dry season, you could see how bad shaped is the road. For the water, we have to take decision upon the force of the current. You know, during taking a patient, if a healthy man dies, what it would be? So we take decision till the rain and storm stops. The road in the rainy season is muddy. The wheels of cow pulling cart or hand cart gets down. So the patient has to be carried. 2 people have to carry her.
কুলো করে নিউন লাগে এই ধরনের অবস্থা দুইজনে কুলো করে নিউন লাগে।
This marshland has only boats to communicate in wet seasons. In dry season, this boundless water turns into boundless sand. At that time, the villagers has no option but walking to Lakhai Main or Hobiganj. In dry season, sometimes the critical pregnant women are carried hanging in bamboos to the health complex. If luck is favorable, the pregnant is saved or has to surrender to death. Health official of Lakhai sub-district informed about the difficulty of the pregnant women of marshland area.
In the dry season, the patients who come from inaccessible areas cannot get the ambulance service. They are usually brought carried over a broken door or a fishing tool that is locally called polo. Putting the patient inside the polo and putting a bamboo inside the polo for carrying. These are local ambulance. This is how the patients are carried to the health complex. The pregnant women can have problem due to the jerking in the way to her. If she bleeds, the bleeding gets severe. Or for taking too long to come, the patient can get sicker. The reason first thing is illiteracy. Second is the difficulty to come to the hospital. As it's difficult to come, many are not inclined to come or come late.
Chairman and Vice Chairman of Lakhai sub-district emphasizes on local health facilities to be reconstructed and well used and to put within the reach of the mass people.
If what a community clinic needs are supplied, and if those who works in the community clinic works properly, the people who understand what happens here and they will be interested. Many health centers are lack of medicine and other materials. If the medicine and other materials are sufficient in those center and family planning centers, the health workers can give services. I think it help a lot. In fact, it's cooperating.
The UNO advises to put the marshland area in a special health service.
What we should do is to enlist all the pregnant women. Anyhow, we must have information on them. The health authority or family planning department has to do it anyhow, and the pregnant women must be given advices in the man-to-man way on antenatal checkup or tetanus injections or nutritions. To bring those advices and everything, they must be included in the health network. Our problem is lack of manpower. In the health complex, there are 9 posts of doctors, but we have maximum 4 doctors. The health and family planning workers are few, and their monitoring on their duty is also not very much. That is why we cannot reach the pregnant women in the marshland area. Their place is inaccessible is also a problem.
আমরা তাদেরকে পৌঁছাতে পারি না, প্রতিটা হাওরের এলাকার মায়ের এমনি পৌঁছানোটাও দুষ্কর।
And District Coordinator of Hobiganj's Mamuni project, Mohammad Faiz Kausar, advises to take a coordinated plan.
গ্রামের সাধারণ মানুষকে যদি
If the mass people of the village are assembled and if they are aware to know the fact that government operating health complexes are working here, if the mass supports government management, If we can work all together, then this problem can be solved very fine, I think.
In the twilight, the color of sky changes to an unearthly shade. It feels that it would have been more enjoyable if the women of this marshland would not be at risk while giving birth to the child.